Hi, very good morning. I'm Dr. Janak Patel. I'm MD General Physician. Today we are going to discuss regarding one of the very interesting topic. We can consider that as a hottest topic at present. Everyone should be aware of it. So we are going to discuss today regarding antibiotic resistance. You can consider that as even biological weapons which we are creating. So antibiotic resistance is microorganism becomes resistant to the antibiotic which were able to kill them, but now they are resistant, so that antibiotic does not work on that microorganism. This is also called as superbugs. This organism are called superbugs. So drug resistance is also utilized as a word, superbugs. So the antibiotic is not able to kill those bacteria or microorganism. We can call those as a superbug. And there was one name given behind our capital, Delhi bugs. This is mainly because of overuse, abuse, misuse, and we can also call underuse of antibiotics. And you can consider this as biological weapons. You can call that as biological bombs, which are created by different countries. But we are the person who are creating this particular, and it is going to have a very major problems for all of us and for our next generation. So do consider this as a dangerous condition what we are creating, and we should take all the steps to prevent this creation. We'll be discussing under certain headings: introduction, different causes, mechanism, effect of antibiotic resistance, and how we can prevent. So we have to stop this creation of a resistance by a bacteria against this antibiotic. So we should use the antibiotic wisely. You know that antibiotic is the most important discovery in the modern medicine, and it was done about, I think, approximately 70 or 75 years back. But also we should be aware of it. Antibiotic utilization leads to what we call as a collateral damage. Along with the benefit, there is a damage. Now if we restrict antibiotic, what we call as an inadequate therapy, a seriously ill patient who is infected by a microorganism, you can have a severe increased mortality. So antibiotic has to be utilized. So during utilization of an antibiotic, at the same time we should say that we do not create a collateral damage like antibiotic resistance. You know, these are all famous people. They are like what we call as a new ideal antibiotics. A new antibiotic is researched, it is put into market, it is most active, but because of misuse, overuse, abuse, we create what we call as antibiotic resistance, or we create superbugs. And you know, these are all superbugs of our society. We don't want to create in microbial agents. We don't want to create biological bombs. So avoid misuse. We are using this antibiotic every now and then. So misuse, abuse, overuse, underuse of antibiotics should be stopped to prevent development of resistance. We are using at breakfast, at lunch, even at dinner, and even every now and then when we are taking snacks. We are utilizing like breakfast, lunch, dinner, and snacks. Lot of antibiotics are consumed by lot of people. The another major problems to increase our production, animal production or agriculture production or poultry productions, for what we can call as production in a fishery, etc. We are giving tons of antibiotics during this particular increased production, and we are creating what we call as resistance. So resistant microbial infects these animals, fish, agriculture products, etc. And from there, it comes to our table in the form of a food materials, because we consume vegetarian as well as non-vegetarian material. So we should be aware of all this, and we should prevent development of the antibiotic resistance. So we have to be a part of this solution by decreasing the use of antibiotics in animals, fishery, birds, as well as agriculture products. So misuse of antibiotics, overuse should be avoided. So we don't want to create a drug resistance organisms we call as a superbugs. So these are all superbugs which we are creating. Now we know that there are a lot of microbial agents which are already at present resistant to good number of antibiotics, and they are at our doorsteps, and they will involve us, we and our next generation, and we are going on creating newer and newer resistant antimicrobials. So we should avoid all this. So we don't want another superbugs to be created. So antibiotic resistance has now become one of the three greatest threats to the human health. Say like hypertension, diabetes, cardiometabolic syndrome, malignancy, myocardial infarction. These are the greatest threat to the human health. And now antibiotic resistance is overcoming all those. And it is definitely like an atom bomb. We call biological bombs. So antibiotic resistance is microorganisms that are not inhibited by usually achievable systemic concentration on an antimicrobial agents with a normal dosage schedule, or it falls below minimum inhibitory concentration. So the same antibiotic which was effective before now is not effective, and that we call as an antibiotic resistance. So we don't want that antibiotic resistance to occur, because once the antibiotic resistance occurs, now that antibiotic will not be effective and will not be able to cure the disease. And if it is not effective, the person is going to have increased mortality and increased cost of treatment. So this is a simple diagram showing you, this is a non-resistant bacteria. They multiply. As soon as you give a drug, they are killed. While a drug-resistant bacteria, they multiply. Even if you give a drug, they continue to multiply. They are not killed by that antibiotic which was effective before. So that is drug resistance. Same picture shown here. This was normal. When you give antibiotic, they are killed. But now there is an antibiotic resistance which is because of mutation. And now, even if you give an antibiotic, they are not affected, and they multiply and they laugh at you. So that is what we call as an antibiotic resistance. Now this resistance is not only to the antimicrobial, it can be to the antiparasites, we call antihelminthic, antiviral drugs, antifungal drugs, and even cancer cell become resistant to effect of what we call as a chemotherapy. So you do come across the resistance in all these particular cells, bacteria, parasite, virus, fungus, etc., and even cancer cells. So it is a term we call, some are born great, some achieves greatness, and some have a greatness thrust upon them. So some microbials are born with resistance, and this is what we are creating at present. And some microbial now achieves the resistance because of at present we are using those drugs in an infected person. And some microbial have a resistance which we are creating by thrust upon them. These are the things what we are creating at present. So you can have a resistance which was also a threat was given by Fleming, which he first invested, or he first identified what we call as a penicillin, He was the scientist who identified penicillin in 1946. At that time also he had given a warning of possible danger of antibiotic resistant bacteria. And still we have not improved on that particular part because there is a constant use and misuse of antibiotics. Now we are also coming across what we call as a cross resistance. A microorganism becomes resistant to one antibiotic, but because the group of antibiotics are having a similar type of an action, so you get a cross resistance. Say as for example an antibiotic which is resistant to penicillin, also it will have a cross resistant to cephalosporin and opposite of that. So that is called as a cross resistance. We are facing at present the biggest threat, that is MDR tuberculosis, and that has been created because of misuse of anti-tubercular treatment. So the commonest cause of antibiotic resistance is because of overprescription, lack of knowledge of antibiotics, so patient does not finish the complete treatment. There is an overuse of antibiotic in fishery, farmings, cattle fields, we call as even agriculture parts, etc. And we in a hospital, because there is an antibiotic resistance, we get poor infection control in a hospital and clinics. And then it is easily transmitted because we don't have a good hygiene. And because of the lack of hygiene and poor hygienic control, we transmit those infection to another person. And we don't have at present a newer antibiotic which is being developed so fast, because one antibiotic to be developed, to be researched and goes through all the different phases, it takes a very long period. At present very few antibiotics are under those particular drug trials and to get an approval. And this is the biggest things what is being happening. If you see that in human, tons of antibiotics are being prescribed. Almost 50% of the prescription, antibiotic prescription, is for the human being. 40% are for animals. For agriculture plants, etc., 0.1% only. And for aquaculture, that is for fishery, etc., 1%. So we are just drinking antibiotics, we can call that. And good number of antibiotic is thrown out via stool. And that goes back to the what we call as soil. And in soil, the microorganisms which are present, they slowly become resistant. And that is given back to us in the form of food materials. Non-vegetarian, vegetarian. And we get infected by a resistant microorganisms. So this is how the animals, birds, then cattle fields, agriculture, etc. Lot of antibiotics are utilized, and they produce what we call as antibiotic resistance bacteria, and that bacteria will be transmitted from what we call as a non-vegetarian food and vegetarian food, from farms to the table, and we get directly entry of resistant microorganism in our body. So this is the biggest problem what we are facing across. So we have to overcome this particular part. So you can see this is the common, these are given in a little different types of pictures. These are what we call as a birds. These are animals. These are, you can see the animals. Lot of antibiotics are given to those people, even to what we call as a fishery. And you create a resistance microorganism which infects these animals, birds, fish, etc. And finally it is transmitted to the human being. And you can see that the amount of antibiotic utilized, this is a slide which is showing you in 2011. So in human being it was 7.7 million pounds of antibiotic was sold for human beings. And you can see that it was sold for poultry farms, fishery, animal products and agriculture. And you can imagine at present after the 10 years extra, this must have increased double fold, almost nearly double fold. So do keep it in mind. So we are creating this particular. So it is because of overuse, misuse. So what we require is to prevent this particular misuse. And you can see in India, India is the world largest consumer of antibiotic. Use of drug has been more than double between 2000 to 2015. Almost it has double in 15 years. And now I think within 10, 12 years, it must have got double. Against the global antibiotic increase, 65% of India in global, and in India it has increased by 103%. So the use of antibiotics in India is increasing like anything. So we should try to avoid all these things. And this is has to be done by a doctor, nurse, pharmacist, our government, your pharmacist industry, our media, etc. should continuously do all those things and educate the people. And because of misuse, overuse, abuse, we are creating superbugs. So we should keep it in mind. We call multi-drug resistance organism we are creating. This I've already told you, because of overuse or because of misuse. How you are doing overuse, misuse, we'll be talking in short. And when you use an antibiotic, we get resistance, which is the most dangerous complication. Once in a while, you come across hypersensitivity, toxicity, and super infections. So antibiotics are necessary for bacterial infection, but antibiotics do not work for everything. This should be kept in mind. So please don't end up having the price. So do keep it in mind. This is a very important slide which shows that if you got a viral infection, antibiotic is not going to work. So antibiotic does not work on a viral infection. We don't have a knowledge regarding which is a viral infection. So we misuse that particular, and we are one of the person who contributes to development of antibiotic resistance. There's a good number of viral infection, common cold, influenza, bronchitis, most of the cough, mainly upper respiratory tract, some ear infection, some sinus infection, stomach flu, etc. All these are viral infection. There are good number of others also, like mumps, measles, herpes. All these are viral infection where antibiotic is not going to work. We should be very much clear. So while you are taking an antibiotics for viral infection, see that it is not going to cure that infection. So keep other people getting sick. It is not going to help your child to become better early. So don't consume antibiotic when you are having a viral infection. Think twice and seek the advice of a doctor. So stop self-medication. Good number of time in our India, self-medication is very easy because over the counter antibiotic is easily available. We go, just tell them that I've got sore throat. A pharmacist will give you an antibiotic. This should be stopped at the level of pharmacist. And also, a doctor should not prescribe an antibiotic for viral infections. This is created by a doctor. It is said that 1 in every 3 patients in hospital in England, this is a slide which is from a person who has given a picture, that in England, every 1 of 3 patients is receiving antibiotic. And almost, if you take entire population, 1 person of 3 in England will have 1 course of antibiotic each year. You can see the percentage of consumption of an antibiotic even abroad. And it is more in India. You can just imagine that. So because of overuse, almost we are taking at breakfast, we are consuming at lunch, dinner, and even we are consuming in between also, like when we are taking snacks. It is almost like breakfast, lunch, dinner, and snacks. So there is a lot of misuse, overuse, and abuse. And this happens very frequently. As soon as a child or a person a well-educated person, he becomes better, he will stop the antibiotics. So that should not have happened. And because of misuse, overuse, you start getting antibiotic resistance, which is by intrinsic factor, or we call natural factors, or acquired factors. And that acquired is genetic method, which is by chromosomal mutation or extra chromosomal plasmid method. So these are the different methods by which we develop antibiotic resistance. So I'm not going into detail. Natural method and acquired and inacquired chromosomal, and we call plasmid. In a chromosomal, that is a mutation. So now bacteria will become resistant to that antibiotic. And these are the different mechanisms. We have enzymatic drug destruction, prevention of a drug penetration and accumulation, alteration in an antibiotic or a target sites, and rapid ejection of a drug from a microorganism. These are all the different mechanisms by which you develop an antibiotic resistance. There is something called as a horizontal transfer also. That this horizontal transfer is mainly by means of what we call as a plasmid. And this can transfer antibiotic resistance from one organism to another organism. This I've already shown you, that if you have got non-resistant bacteria, they start multiplying. In that, if you come across one which has got a mutation of a gene, now you don't get a non-resistant bacteria multiplication, but resistant bacteria go on multiplying, and now this particular resistant bacteria will survive for a longer period and will be easily transmitted to the human being and to the animals. Animals, fish, birds, etc. So there is some mechanism called as a selective pressure. I am not going into detail. Same thing what we have shown you before. One single resistant bacteria will start multiplying. The normal bacteria will be dead, but that resistant bacteria will go on multiplying, and they will be mainly organism which will survive, and they will pass on infection to the other person. Now this is called antibiotic resistance cycle. So because of increased antibiotic use, there is a development of resistant strain. Because of this resistant strain, you get repeated infection and serious infection. So usually empiric treatment is given. To that is going to increase your morbidity, as well as you are going to use more antibiotic, and that will require more hospitalization, more antibiotic, and it will increase healthcare resources, and expense etc. will be increased. Because of more antibiotics, you are creating further resistance, and there is an increased mortality. More and more antibiotic, more side effects, more complication, and increased mortality. And these cycles continue. This is shown here also. So you get infections, antibiotic is utilized, you develop antimicrobial resistance, and you enter into that antimicrobial resistance circle. If you want to break that circle, one, you have to prevent infection. This is most important. So you prevent transmission. Then second, you will require an effective antibiotic treatment. And you will have to optimize the use to reduce antibiotic resistance formation and prevent the transmission from here till here. So this cycle you have to break. So you have to take all those precautions. Because of misuse, you are creating an antibiotic resistance. And because of an antibiotic resistance, you are creating lot of problems on society, on government, on a patient himself, on his pocket, as well as on a health system. So there is lot of mortality because of this antibiotic resistance infection. Probably in India this may be more. This is in USA. Out of 2 million infections, 23,000 deaths each year because of antibiotic resistance. But in India it may be a very huge figure. So because of that, serious illness, longer recovery, longer hospitalization, frequent hospitalization, more doctor visits, more expenses and burden on society as well as government, and individual pockets. These are some of the organisms which are resistant, and these are some of the infection which occurs. Say like pneumonia, as pneumonia become resistant to penicillin, typhoid becomes resistant to what we call as a S. typhi. You got resistant to many antibiotics. Tuberculosis, you got resistant to rifampicin and Isonex, etc. This is a big list. At your leisure time, you can go through. These are all the different resistant superbugs which are being identified, and newer superbugs will come in your market. So we want to break that particular cycle. So there is penicillin resistant streptococci, that is multi-drug resistant streptococci, pneumonia. Then methicillin resistance, Staphylococcus aureus. Then community acquired methicillin resistance, healthcare acquired, then vancomycin resistance, vancomycin intermediate resistant, then vancomycin resistant enterococci. All these are different organisms which has emerged, and we label them as superbugs. And in near future we will have many more resistant variety of superbugs. You might have few more in this recent days also. And this is what we call, we give a burden on the person himself, on an entire society, government, as well as burden on doctors. He is also more likely to get those super infection transmitted from the patient to himself. So this becomes what we call as a hospital-borne infection or nosocomial infections, and those nosocomial infection is usually by a resistant organism, and this is the main important part of it. So resistance is a concern we have already mentioned. You can go through your at leisure times. These are called superbugs, and it is not a threat only in India, it is all over the world. It is all over the world, and newer superbugs are coming. To identify those, you have to suspect, you have to do a screening. The main important part of investigation will be culture and antibiotic sensitivity. All laboratory may not have all those facilities available, but you should ask for antibiotic sensitivity and culture and antibiotic sensitivity, and then only. And it can be done by many different techniques. You can use a disc diffusion technique, or you can use many different methods which are more accurate. And once you confirm the diagnosis, now what you require is prevention. First is duty of doctor. Second, duty of patient himself to complete the complete course and have a trust on a doctor. Pharmacist should not give antibiotic without the prescription of a patient, of a doctor to a patient. It is also, society should take a part in prevention and help doctor, pharmacist as well as patients. It should be also an active step done by a government and different bodies. So we say that every person should take a step in prevention of antibiotics resistance. Media should also help in prevention part. Prevention should be done by all people, and best is everyone should stop misuse, overuse, abuse and underuse. And we want to protect all human beings and our next generation from biological attacks, and that is by a resistance microorganism. For that purpose, antibiotics should be utilized at the right time. Right antibiotic drugs should be chosen by culture and antibiotic sensitivity. It should not be pure simple empiric or we call prophylactic treatment. It should be given to the right patient. Also, you should have a right dose, full therapeutic dose, proper route. If required IV, it should be given IV. If required oral, it should be given oral for full duration of the time, and person should also consume the full duration. All this should be done to prevent and break this cycle. You want to break this cycle, go through that at your leisure time. So there are, some people say 6 facts about antibiotic use and abuse. Antibiotic is a life-saving drugs. Antibiotic works only on microorganism, particularly we call bacterial infection. They do not work in certain viral infections, so that should be kept in mind. Good number of viral infection are in upper respiratory tract, ENT infection, etc. It should not be utilized as a routine in a case of a upper respiratory tract like flu, common cold, etc. If a person is having a green color mucus, it does not mean that it is infected. You should confirm the diagnosis that patient has got a bacterial infection, and then only antibiotics should be utilized. And you should be aware of the risk, potential risk of an antibiotic, and doctor should be also aware of it, and he should prescribe cautiously. Some people say 12 steps. Always go from bottom. Base treatment is vaccination, so you don't create any antibiotic resistance. If a person is having catheter, catheter should be out as early as possible. Target the proper pathogen by having antibiotic culture and sensitivity. You should take an advice of an expert. Practical antibiotic control should be utilized. Always utilize local data. Treat the infection, not the contamination. Treat the infection, not colonization. Know when to say no to a vancomycin. Stop treatment as soon as the person is well controlled and cured. Isolate the pathogens and contain your contagions. And prevent transmission. Use proper antimicrobials wisely. Diagnose and treat the effective and prevent infection. These are all the steps you should take. These are what you do in a good practice. We have mentioned this. You can go to your at leisure time. It is quite long. Go through, have a pause, and look at it. These are general principle while you use an antibiotics. This is what steps you should take during prevention of drug resistance. So go through your leisure time, have a pause, and have a look. In short, you must be aware of there are antibiotics which will be acting on a bacteria only, viral. Antiviral will act only on virus. They will not act on bacteria. This will not act on virus, parasites, antifungal, etc. But some antibiotic may be effective on a parasite. Some antiparasitic drugs may be effective on a bacteria. That particular exception you should accept it. Say like metronidazole, which is effective on a parasites, is also effective on a gram-negative organism. These are some exceptions, not for all antibiotics. So how to avoid using an antibiotic misuse is mentioned here. Again, you can go through your at leisure times. Do not save antibiotic for later times. Do not consume antibiotic which are expired and old. Do not take antibiotic for cold, flu symptoms. Only use antibiotic when necessary for bacterial infection. Always take an advice of a doctor, and do not utilize the antibiotic as an alternative treatments. Avoid using antibiotic frequently for extended period unless necessary. Never break up and crush antibiotic pills because you can reduce its efficacy. And avoid dairy, fruit juices and alcohol for 3 hours after taking an antibiotic dose, because some of the antibiotics absorption can be delayed or can be reduced. You should be aware of all those things. So by and large, the failure of antibiotics action and resistant development is because of the failure to complete therapy, skipping the prescribed dose. If you have given 3 times a day, person consume only once a day or twice a day, or he skips the doses, he reuses the antibiotic for similar type of complaint, leftover antibiotics is consumed, and good number of time person takes self medications. So all these are the prime cause of antibiotic resistance. So stop overuse of antibiotics. So ask the person to encourage what we call as an immunization is better than getting an antibiotic after getting an infection. So prevent the spread of infection by good hygiene, that is good hand washing, and immunization, proper immunization. So that is the best part of it. So there is a good number of mistreatment done by a doctor. So a doctor is the prime person who will prevent this particular from spreading infection from one person to another person as well as creating an antibiotic resistance. So doctor is the prime person to use antibiotic cautiously, or we call wisely, and reduce the use of antibiotic as much as possible and use only when it is required in full therapeutic dose and for full period of time, and he should explain the person to complete the treatment. Now good number of time we are using antibiotic for viral infection which is not cured by use of antibiotics, and that is used by good number of doctors, and we can use what a word we call quacks who does not have any knowledge of antibiotics or of infection itself. So always keep this thing in mind. So avoid using antibiotics in unnecessary. And this is a very common thing which is happening in India. Doctors are bound to prescribe an antibiotic. That is a big term. All doctor will not prescribe antibiotic. Yes, good number of doctor will prescribe, but you have to have a trust on a doctor. And doctors should use antibiotic precautiously, wisely. So don't forget to take one of our antibiotic free sample before you leave a hospital. So anyone who gets a free sample, always consider that this is not a proper drug what a doctor has given, because he has given free. So he does not consume and complete the full course. So this is a common problem which is happening in India. So without a proper direction of the patient takes the drugs, that is what we call self-medication. They do not maintain the dosage interval and complete the doses, and patient will stop. This is at the level of patient. Will stop the drug as soon as he feels better, and he will reuse those remaining drugs whenever he gets a similar symptoms. So this is most likely to produce antibiotic resistance. So keep that thing in mind. This is the best way of prevention of a spread. That is we call as a hygiene. Hand washing is the best way of prevention. So hand washing will spread the antibiotic resistant strain to be spread from hospital, clinics, etc. to a patient, and from a patient to a doctor. So clean hand saves life is a prime motto. So you try to do that particular part. So good personal hygiene will prevent infection. So it is always said that prevent infection. It is your hand which is going to spread, and it is in your hand to prevent spread of infection from a patient to yourself and from you to a patient. So hand washing is very, very important. That's why I put so many slides. So keep that. So that is the first preventive measure. Another preventive measure is now what we are doing for COVID. That is cover the mask, don't cough, don't sneeze, and even if you sneeze, keep a handkerchief or any particular mask, etc. in front of your nose. Do a good hygiene, personal hygiene, use a gloves, etc. Get a proper immunization at regular interval. This is what we call as an Indian scenario. There's a lack of community. There is a lack of community awareness. Drugs are easily available over the counter. Absence of central monitoring. That is a major problem in India. In infants, lower respiratory tract infections, diarrhea, etc. Usually these are given antibiotics immediately by a doctor himself also, or by self-medication from a family member, because someone has given once for the similar symptoms, they reuse that particular medicines. And good number of bacterial infections may be resistant to the drugs, and the same drug is prescribed again, and person does not get results, and he goes on changing the medicines. This is a major problem in India. We call as a multi-drug resistance Mycobacterium. These are some of the bugs which were identified. It is called New Delhi metallo-beta-lactamase resistance organism. So it is called NDM, New Delhi metallo-beta-lactamase resistance organisms. And these are resistant to good number of antibiotics, and most commonly beta-lactamase antibiotic, including even carbapenem. So to keep it in mind. And that was given a name, New Delhi Superbugs. So we are always afraid, we are prone to get the infection by this, what we call as an NDM organism. So you should be aware of it and you should try to prevent that spread of infection by having a good preventive measures like personal hygienes. What you require at present, develop a new antibiotic which will bypass the drug resistance. And at the level of doctor, at the level of chemist, at the level of pharmacist, at the level of pharmaceutical company, and at the level of patient himself, judicious use of existing antibiotics should be done to decrease the drug resistance. We need a newer antibiotic development, but you can see that only 15 antibiotic of 167 has under development had a new mechanism of action with a potential property to combat the multi-drug resistance. But in a short period, because of misuse, overuse and abuse, even this antibiotic do not work and bacteria develops multi-drug resistance. And there is no incentive for a companies to develop a newer antibiotic. You can see here slowly there is a decline in the antibiotic approval in past 25 years. And this is the major problem in India. You should have a proactive campaign for development of a newer antibiotics. And it should be also a campaign to, all this should be put in the media. You should have a regular campaign. You should have a campaign by means of webinars, etc. to prevent a misuse, overuse, say no to misuse of antibiotic, etc. And there is one hope. There is something called as a phage therapy. So in near future, this will be one of the things. This is nothing else but there are therapeutic use of a lytic bacteriophage material to treat the pathogenic bacterial infections. So this is one which is in near future, it may be one of the alternative approach for microbial infections. There are newer antibiotics which are in market like linezolidine, tigacelline, daptomycin, talabacin, uh, fourth generation and fifth generation cephalosporin, etc. These are some of the newer antibiotics. These antibiotics should be used judiciously so that we can utilize them for a longer period and we do not develop resistance organisms. So we should containment of resistance should be done at the level of physician, patient as well as pharmaceutical companies. We should be aware of the antibiotic resistance which is because of environmental factor, prescriptions, this is done by a doctor, patient related factors, this is for a patient, and this is a drug related factor. This should be given knowledge to all people by means of a media, TV, regular pamphlets distributions, regular classes in college, pharmaceutical companies, etc. should have all those programs. So these are environmental factors and skipping over all this. This is drug related, this is patient related. Person should have all, should complete medication, should not have a self medication, should have a good education, he should go through a different programs, he should have a regular internet search, etc. He should have a good personal hygiene, all these things should be done. And this is prescription related. You should have a proper prescriptions and you should avoid environmental factors, empirical use should be avoided, and you should have a good knowledge when to use a empirical use, when to use a definitive use, etc. And you should avoid evolution of antibiotic resistance. Faulty antibiotic use should be also avoided. So you should not have abnormal use of an antibiotic. Over prescription should not be done. Empirical antibiotics should be utilized only when it is necessary. Before using an empirical antibiotic, you should have a good confirmation by microscopy, gram staining, as well as by what we call as a antibiotic sensitivity with culture. So empirical antibiotic selection should be done only after culture and antibiotic sensitivity. All this should be in the mind of a doctor before prescribing an antibiotic as an empirical treatment. So that should be an evidence-based medicine should be done. Definitive treatment should be always after culture and spectrum, that is antibiotic sensitivity. Always you should be aware of whether one agent to be used or two agents to be used. By and large, always prefer using a combination of therapy, which will help you to reduce the side effects as well as having a better effects. Definitive treatment is always useful. You should use an optimum dose, proper route and proper duration of treatment should be utilized. And always get the benefit from antibiotic sensitivity and culture reports. Remove the catheters as early as possible. Vaccination. Avoid steroids. Drain the pus. If required, amputation and remove the catheter as early as possible. Always get the help of microbiologist. They should be in a close contact. So get the help from microbiologist to balance that particular part. As far as the hospital acquired drug resistance, that should be an hospital antibacterial policy. That should be at a regular interval. Antibiograms of hospital should be given to all the doctors who are practicing in that particular hospital. And according to the hospital antibiotic policy, a proper antibiotic should be utilized. And at a regular interval, hospital antibiogram should be revised. These are all the different organisms which are being there, which are resistant to which antibiotics, and these are the antibiotic now which are being utilized. And in near future, this organism will also become resistant to these drugs. So we should take a precaution that this should not happen. So go through at your leisure times. So selection and resistance, we require that. Now we should concentrate more on vaccine and phage therapy, because this will be one of the things which will reduce your amount of resistance, as well as always the use of antibiotic in agriculture industry, fishery, animal industry, and even birds. You should have a restriction of use of antibiotic and it should be used properly. So use antibiotic wisely. Avoid infections at the vulnerable sites. Improve your immune system so that you don't get infections, which we are doing now for COVID. Proper hygiene, follow the prescription properly and take it for a complete period of time. There should be a regulatory body which should frequently go on revising your what we call as the guidelines. We want to defeat a multi-drug resistance and have a good life. So solutions are there. You should have a stewardships programs. There are certain important part of this, that is we call as anti-microbial stewardship programs, ASP short form it is called. They should help to reduce the amount of decreasing the antibiotic resistance. There is another program called as a Health Antimicrobial Prescribing Initiative, short form it is called HAPI. So these are the parts of that particular program which will decrease your antibiotic resistance. There is another program called as a SMART, that is study for monitoring antimicrobial resistance trends. There is another Get Smart. So we have to become a smart. So we should know when to use, how much to give, how long to give, what route to give. All those should be utilized. They celebrate Antibiotic Awareness Week. Instead of celebrating only 1 week, it should be all throughout, every day, every hour, every minute of our life. Antibiotic awareness should be there at every seconds. There is another program called as the National Antimicrobial Resistant Monitoring System. There are good number of this particular system like FDA, CDC, USDA. We have got Indian pharmaceutical companies also, Indian regulatory body also. They should take an active part. This is in conclusion I'm now finishing my conclusion that antimicrobial resistance is an emerging global threat. There should be a definite strategy to prevent the development of the antimicrobial resistance, and it should be revised again and again. Judicious use of antimicrobial agents by a healthcare professional and general population, that is means of a patient. Preventing unjudicious use, or what we call as a misuse, overuse, abuse of antibiotics in animal industry, farming industry, what we call as a fishery, birds industry, etc. You should avoid incorporating antibiotic in commercial cleaning products, because this also increases the antimicrobial resistance. Proper pharmaceutical waste management should be done by pharmaceutical companies. So there is a take-home message that target the definitive therapy for a proper pathogens. Treat the infection, not contamination. Treat the infection, not colonization. Say no when you want to say to vancomycin as well as fourth generation cephalosporin, carbapenem, because these are the only antibiotics which are left for resistance microorganism. Isolate the pathogen, have a good culture, have an antibiotic sensitivity test, break the chain of resistant antibiotic cycle. A simple bedside test should be done to detect an organism is present or not. And you should always take the advantage of a microbiologist regarding a culture and antibiotic sensitivity. Choose the appropriate antibiotic. Think, I'll say 1,000 times before prescribing an antibiotic. Are we using a right drug? Are we using a right drug for a right bugs? Answer should be given, and then only prescription should be written. Allow the antibiotic to do their jobs, and you should revise your knowledge at a regular intervals and help to prevent antibiotics. And on the side of the patient, finish the full prescription even if you are feeling better. So all this has to be together. We want to combat the drug resistance. If we don't take the action today, we'll not have cure tomorrow, and we'll have a major mortality, very, very high mortality to ourselves and our next generation. So always, and this is what is showing, no contaminate, big surveillance, poor drug quality, irrational use of a drug should be avoided, lack of research, all this should be avoided. No infection controls, all this should be avoided. And this is issued by WHO. What we should do, we should have a regular knowledge from Facebooks, internets, regular classes, or what we call as the live webinars, etc. So have that particular thing and help yourself and help the society. I hope this will be very, very helpful to all of you, and you will be taking active part in reducing the development of antibiotic resistance, and you will help yourself as well as society and your future generation. So I finish my lecture here.